Jose, thanks for coming here to share your story.
It's a pleasure to be here and be able to help people.
So you've got varying degrees, credentials, etc. What is your story? How did you get involved in the work that you've been doing?
Well, 25 years ago, I went to pharmacy school. It was one of the first schools that was doing the doctorate program instead of just a bachelor's program. So I graduated, and after that, I went to the military, and where I work as a pharmacist. And it was a really good job. I enjoyed it. But about 5 years into, I got sick, and they medically retired me.
What were you sick? What kind of sick?
Well, it was a combination. It was my diabetes and then I was going through a terrible divorce, and that affected my nervous system. And they said, well, your diabetes is not under control, and we're just gonna get you out. I said, I don't want to. I only have 5 years to go, but.
So then you had to retire from the military.
Yeah.
And then where'd you go from there?
Well, then I went civilian, and I started working for CVS. While I was working at CVS, I got a call from this lady. She told me that she was a doctor, and she gave me this prescription for a patient. And then I looked it up, and she wasn't on my computer. So I said, okay, I'm going to need your DEA number so I can put you in. And she gave me a DEA that started with the letter M. M is for mid-level practitioners. So I said, well, you told me that you're a doctor, but that's normally for nurse practitioners and PAs. So then she told me the story about how she was a naturopath. And all the things that naturopaths do and how they help people. And at the time, it's like after all those years in pharmacy, I realized I wasn't helping anybody. Not counting pills.
Yeah.
And the pills were not helping anybody either. So it's like, So I started thinking about it. She told me about a school, local school. So I decided to investigate, and about 5 years after I talked to her, I was able to start school.
And what was it about the naturopathy that attracted you? Like said, this is something I want to do.
Well, the philosophy behind the belief that a patient's body should be able to fix himself if you're given the proper opportunity. Whether you're given the raw materials that it needs, the oxygen that it needs, all the different things that it needs. They don't have to give him pills, because nobody has hyperplasia because they have a deficiency to lisinopril.
Right.
Or, let's say depression because they miss Prozac.
Right.
It's like, no, it's because something changed, and we can make it better if we find what it was that changed and put it back the right way.
More about getting to the cause rather than trying to mask a symptom. Yeah.
And that's part of the philosophy. You always treat the cause. It's like treat the patient and not the symptoms.
Right.
Things like that. So I just loved that. It's like, wow. So and it took me 5 years. I wanted to go right away, but it took me 5 years to set up my affairs and things so I can go to school and just work part-time. So
yeah, and so fascinating with your background, and we're here having a conversation with you as a patient, though. So with that background and understanding, your pharmacy degree, your naturopathic degree, you had some health challenges. What were they?
Well, I had diabetes, I had sleep apnea, I have depression, and a few other things. But then, and while I was in school, before I graduated, about 6 months before graduation, I ended up having a devastating stroke.
How long ago was that?
That was about 3 years ago.
3 years ago, okay.
Yeah, it was Halloween 2015. Then actually on Halloween Day, it was the 31st of October. So, it's like, but most people would look at a stroke as a curse or something negative. To me, it's not. To me, it's been the greatest thing that happened to me. not the best, but one of the greatest, because
You say there's a blessing in
it was a blessing. It was a blessing. I slowed down. I rekindled my love with my wife. I mean, before that, I was going nowhere fast. And then I realized, like, maybe I'm supposed to work with people with stroke, because now I can understand them.
I noticed when you're coming in that so the paralysis that you're experiencing is on your right side.
It is.
Yeah, but I don't see that your speech is at all affected.
No, it's funny that most of my body, the only thing I really still has an issues is with my arm. My arm is my right arm, but my leg is doing pretty good. I mean, my neurologist told me I would never walk again. He said, go get Social Security, whatever, retire, because you're not doing anything. I said, well, we'll see. You know, I've never been the kind that would sit home. So,
Well, and it's interesting because your background had you understand the body really has an incredible capacity to heal itself.
exactly.
Yet you have someone, and I think it's sort of arrogant to say, you're not going to walk again. I mean, isn't it sort of like doing a disservice to the patient? I mean,
To me, he was making a challenge. So, I mean, he wasn't doing a disservice to me, because that's what motivates me. It's like when somebody told me you can't do something, I'll go out and do
you're
it
unusual.
just to prove it. Most people will succumb and say, okay, I just...
They become victims. Yeah.
So, but he was probably going based on the fact, like most people's stroke happen on the cortex, around the top. There's a new and an old brain. The cortex in this area here, this is what we call the new. The old is the brainstem. Well, my stroke was in the brainstem, and this is what governed all the autonomic functions of the body, like breathing, like closing your eyes. Now, that's normally something you do automatically. Breathing, you do automatically. I mean, if you think about it, you do it, but most of the time. So when the stroke happened, even though it was happening, I didn't lose any of my senses or any of my sight or anything for 4 days. On the fourth day, I was in the ER, and they had done an MRI on me. And right after that, it's when I lost my right side. Well, I stopped breathing, because it's automatic, autonomic.
So I had to put you on a ventilator.
Well, the nurse ran, and she put me on oxygen, and she kept shaking me and saying, wake up, wake up, wake up, wake up, come on, breathe, breathe. So, I started to breathe, but then I noticed that I was not breathing automatically. So it's like, and she kept having to wake me up and stuff like that. It took me about 6 hours of telling myself, breathe in, breathe out, breathe in, breathe out. I mean, it's kind of like a joke, that you hear about. And it's like, but I actually had to do it.
Wow.
And after 6 hours, I said, man, I can't do this any longer. So if I'm going to go, I'm going to go. So I stopped doing the breathing, and luckily my body had developed a pathway to do that, and I kept on breathing. Otherwise, this is why 95% of the people with my type of stroke die before they make it to the hospital. Because they stop breathing.
Yeah.
And then the other 5%, the 5% that makes it alive, normally don't walk again.
So what was it then from there that brought you to get cell therapy?
Well, I have heard a lot. I even have training on how to do the injections and stuff like that. Heard a lot, but I never thought I could afford it, So I met, Michael and I, Dr. Homo, we went to school together. I had the stroke, he graduated, That's the faith. But we've been friends ever since from 2012. When he started working with the company and he went down to Tucson, my wife and I went to visit because my wife is friends with his wife. So we spent the weekend with them and stuff like that. And he, took me to his place where he worked, told me all that he was doing, And it was like, wow, that's fascinating. He told me about how it's helping people breathe better with COPD because you do it like nebulizing stuff. And he's, one of the things that we didn't do it yet, but we talk about doing some inhale stem cells. So it will go directly to my brain, and it will go and fix the part, hopefully, fix the brainstem. So he told me about it. And then after we left, I think it was a couple of weeks after we left, he called me and said, hey, you know what? I forgot, but we do have a programs for veterans. And we make it affordable for you guys and stuff like that. I said, so we check into it. And I said, well, let's try it. What the heck? So we make an appointment and went down there, and Dr. Homo did the IV with the exosomes in it, and I started noticing something right away. I felt
like what were you noticing?
Well, at first I noticed this, like heat reaction, in where my body temperature went up. Normally I run like a 97-degree temperature, which is 98.6 is normal.
Yeah.
So I noticed this heat around me and stuff like that. Then I said, So, and Dr. Homo asked me, well, you okay? I said, yeah, I'm okay. It's just, I feel warmer, like the temperature is rising, like the room just all of a sudden got warm. And he said, no, the room didn't get warm. So he took my temperature and it was 98.6.
Wow, so your temperature went up to what would be considered sort of a normal level.
Yeah, he's like, oh, wow, this is weird. I never had anything to bring my temperature up to.
Wow.
So, and that was, I'm talking about within seconds.
Right.
I still have the needle on my arm. We had not done the stuff.
Wow.
So then he was, explaining to me, it could take up to 6 weeks to see any difference, blah, blah, stuff like that. But within a week, I could see, I don't think it even took a week. I saw that my fingers were moving better, my arm, I was able to lift it higher. Normally I have this lady that comes over twice a week, Mondays and Wednesdays. And we did this thing on a Thursday. So, and that week, the following week, she didn't make it because something wrong with her sister. So, but she came over the following week. So it was like a week and a half. And then she started doing this same thing that she does for me. She kind of makes me work and, lift this up and move this over or whatever. And she started laughing and say, what's the matter? And I say, no, I can move your arm like there's no, before it was like moving a 20-pound thing, and now it's just like a feather. It's like a pound or less.
So you start seeing this function coming back.
Yeah, exactly.
And other people, I guess I don't know if it was an occupational therapist or whatever that rehab person was. They're saying, "Wow, you're now they didn't know about you getting cell therapy."
No, they didn't know. I have not told her, and she's a retired physical therapist from New York. So she's not. She's just retired, and she's coming in as a friend. But she knows all the stuff.
Wow.
So she knows how to do all these movements and all the exercises. So she started laughing. And I said, wow, what's going on? She said, oh, this is so good. And it's like, what do you mean? I said, well, look. And then she was moving my arm out like this, all the way to the back. It's like, did that hurt? And I say, no.
Did it used to hurt?
I used to hurt a lot.
Because this is, I know that in many respects, this whole docuseries is about
pain. Yeah, no, and, it used to hurt a lot.
Yeah, but and in your case, we're talking about recovery of function, in respect. But I'm wondering if there were painful aspects to your post-stroke, symptoms.
Well, whenever someone have a stroke, there's nothing wrong with the physical part other than what was wrong before. So it's just the brain connection to that physical part.
Right.
It's not connected no more, so it doesn't work as well.
Right.
So the issue with me is like because it takes time to get rehab, but you lose a lot of the mobility that you used to do. And then your muscles will atrophy and all that stuff. And then certain movement will be very painful.
Right.
Like bringing the arm all the way to here, to this day, it will be painful.
That doesn't hurt for you to do that right now.
No.
Wow. Were you able to do that with your arm?
Before
yeah.
the stem cells, no. I mean, I was able to do this.
Yeah.
Versus I'm able to come here.
Yeah.
And, now I need to relax this stuff so this can be open.
Right.
And this is what she's doing with me now. It's like she's helped me stand my arm. And she said, okay, now I need you to come back like this. And then we go like that. And that is something we couldn't do 3 months ago.
Wow. So any other things that you noticed?
Well, I noticed that I can go back and forth with my ankle. My foot can go like this, okay, without bending my knee. Because remember, that's the problem. It's like when you do something with the leg, the arm wants to engage.
Right.
And sometimes they engage. This is why you notice that people with stroke, they walk like this.
Right.
It's because they're engaging the leg.
Right.
But the arm is also engaged. So especially the bicep. So I notice function-wise, I will say that I have probably gained a 20 to 25% of where I was after 3 years. But I gained that in 3 weeks.
And normally, after 3 years post-stroke, you don't get a bunch more recovery after that. I mean, it's pretty much what you got is what you got.
Yeah. Well, I mean, you could get more, but you will have to do different things. And this was done within, it will still take more time. This was happened to me within 3 weeks.
Were you surprised by the result?
I was.
Yeah.
To be honest with you, I was like, because I had tried so many things. Being in the medical field, I have read about so many things. I read so many books and I tried. So I was like, okay, well, I'll try anything, but I wasn't expecting it to be so fabulous. As a matter of fact, I've been talking to Dr. Homo to maybe do a sequel, So, I mean, now I don't know if like some people say, well, if I take one Tylenol and it help, maybe if I take 10, will 10 will kill you. So,
Yeah.
I mean?
But the interesting thing about the cell therapy is that it seemingly is not toxic or doesn't have these adverse effects. And I'd spoken to some people who had multiple treatments, and they seemed to feel like there was a benefit from that. But what's interesting is that a lot of times people are coming in because they've got arthritis, degenerative problems in certain joints, and they're hoping for relief from that instead of surgery. In your case, you're dealing more with a neurological problem that's got residual paralysis, and it seems to be helping that heal too.
Well, from the stroke part of view, that's really what is helping me. But also, I feel that even help. I used to have, so after the stroke, you favor your good leg.
Right.
Okay? And you favor your bad leg and you try to protect it.
But the good leg's taking all the
good leg is taking all the beating.
Right.
So I had noticed that my left knee and my left ankle, along with my left wrist, were constantly in pain. As a matter of fact, when I went to the doctor's office at the VA, they would always ask me, you're in pain? I said, yeah, I'm in pain. What's the number? 7, 8.
Pretty high.
It was because it felt, because you have to do everything with just one side.
Right.
So, but after the stem cells, I would say that my knee pain is probably a 2.
Wow.
With that, and my wrist probably 1, if any. Most times I wake up.
Were you expecting that on your, for lack of a better term, good side, your wrist, your knee, ankle, that was going to get better when you came in for the therapy, or were you just hoping to regain some function from the paralyzed side?
I was hoping to regain functionality. I figured I'm old enough to be a grandpa 8 times over, so I didn't think that anything will happen with the pain, even though Michael have mentioned it, that it will help with the pain. But we didn't talk about how it was going to help me with the pain. We talk about how other people get it for pain. You know, so it's like, wow. So, but, you know, understanding maybe how it works is like these things will go where you need it the most.
It's
So,
interesting, yeah.
you know,
So it's really interesting that you didn't have injections directly in any of those areas, but somehow it seemed like those areas were profoundly affected. I mean, if you're going from, like you're saying, you're 7 or an 8 down to a 2 or a 0, you know, that's pretty dramatic.
Yeah, well, what I had was an IV bag that went into my arm and it went all over my body. Over a period of 4 weeks now, I think that my pain has considerably gone down. My arm has increased at least at 25%.
Wow.
And I don't have pain when I'm trying to do my therapy.
Yeah.
You know, even other pain like back pains, which every once in a while I get from standing too long arm.
That's great. Well, I have to say, Jose, thank you very much for coming and sharing your story. It's a dramatic story, and I wish for you to have continued recovery.
Thank you so much. I appreciate it. I'm glad to be here.
So, Sherilyn, thanks for taking a couple of minutes. You said you weren't expecting to come in and sit down, but you are Jose's wife.
Yes.
Now, we just had a conversation with him, you know, about his health challenge, his stroke, and sort of his background, etc. And since you were here, I wanted to get a sense of, without him in the room eavesdropping, I wanted to get a sense of what your experience was watching him. And I'm curious about two things. What was his anticipation before getting the cell therapy? And then what did you observe? What was your experience of it as far as observing him?
Since his stroke, he has been open to try anything and everything. If he's had even an inkling that it's supposed to help with stroke, he's tried it.
Okay.
And so he's gone through all kinds of stuff, and he's really kind of hit a plateau. And so when he heard about the stem cells, he's like, I really want to try that. So he was quite excited, but he didn't know whether it would really work or not. But he went and he did it, and it's been about 3 weeks since he had the treatment. And is what we've noticed the most is with his mobility with his arm, and especially in his shoulder, because it's almost like it locks up and we don't have much movement with it. And since then, it's like it's totally loosened up. It doesn't have that stiffness and rigidity. When Wood tried to move his arm, it'd be really stiff, and you're really having to push against it and a lot of resistance. And now it just moves really easy. He can even move it on his own.
Wow.
More than he could. We've noticed more rotation in his wrist, more openness with his fingers. And so just even in 3 weeks, it's been amazing, the more mobility that he's gotten, where we can see now he's pushed past that plateau and is starting to progress again.
Has this changed him from his moods and so on? In other words, have you noticed that, wow, he's behaving differently, or are you experiencing him differently as a result?
Yeah. It's hard to watch a man who was so vibrant and so active to be devastated with a stroke. And even though he's tried to be positive and he's plowed through things, he's tried everything, but it's really affected him emotionally. That he's had feelings of being less than a man. He's made comments to me about, how could he be a good husband when he's can't function properly, that he can't even give me a hug. And so for him to be able to have the mobility is something that we take for granted every day.
Yeah.
But for him, this is huge. Just to be able to do something simple, to be able to move your arm enough to hug your wife.
Wow.
That means a lot.
Yeah, I can imagine. So has this maybe brought a new sense of optimism, as far as what the next years can be?
Oh, absolutely.
Yeah, so this is something that is like not just the physical part, okay, I can move my arm X amount of more degrees or 20% more than I used to. But I guess really the issue is, how does this affect your life? And of course, not only his life personally, but your life together.
And again, like you said, it's not just how it's helping physically, but it's how it's helping him emotionally.
Yeah.
Because this is a big thing to deal with. Yeah. And to have that constant reminder that you're not what you used to be, and to be able to get some of that back, that's pretty big.
Quite a gift. Well, I very much appreciate you, sharing this with us and really having us understand some of the deeper and more humanistic aspects of what all this could mean to somebody. So, thank you for sharing that.
You're welcome.
Mary, a pleasure to meet you, and thanks for being here.
Well, thanks for having me.
So, tell me your health history that got you to want to investigate stem cell therapy.
Well, about 8 years ago, I suddenly developed terrible tremors and went to my doctor, and they said, well, we think you might have early onset Parkinson's or something, because my mother had passed from Parkinson's or with Parkinson's. And so that was the beginning of it. That was about 8 years ago, and it progressively got worse and worse, and I ended up with muscle spasms, muscle cramps, fibromyalgia.
Was it
balance
diagnosed as
issues.
Parkinson's?
No, because I refused to do it. Because if I got diagnosed as Parkinson's, then I would have to accept that I had it, and I wasn't willing to do that.
Wow.
So I kept trying different things, and nothing really helped or worked.
Were these things like fibromyalgia? It could be very painful. So
It is.
and so you're dealing with the pain of it, and also a loss of function, I guess, with all these symptoms that you were having.
Exactly. And because of my balance issues, I ended up falling down a commercial flight of stairs all the way down on my back.
Ooh.
So not only did I have the spasms and the tremors and all of that, now I was in excruciating pain from my back.
Wow.
So one day my son came to me and he said, I know you're having issues. So he sent me a podcast of Mel Gibson and Joe Rogan. I'm sure you've heard of that one. And so I watched that. And then he also sent me an article about a young boy who had been in a car accident, who had regained the use of his upper body from stem cells. So I thought, well, if it worked for them, maybe it'll work for me. So I decided to start searching around, and I was accepted into a trial a year and a half ago in July of 2017. And I had one small treatment then, but that was all they could give me. The doctor was very honest with me and said, you're going to need more, but this is all I can provide to you. So I said, okay, fine. So then in August, this past August, I saw the seminar for stem cell centers, and I went to their seminar and listened and realized that they knew what they were talking about. So I was quite excited, and my significant other and myself went and met with the doctor and spent over an hour with the doctor. It was wonderful. So we decided to go ahead and get treated that day, and we got treated.
And how long ago was that?
That was just this past August, the end of August, 1st of September.
So about 6 months ago, or 5 or 6 months ago.
5, 6 months ago, yeah.
And what have you noticed?
Everything's changed.
Everything's changed.
Everything's changed. My back pain is from, like a 12 and constant to...
When you say 12, you mean out of 10?
it's
out of
it's
control
way
pain.
beyond 10. Yeah. I was probably a 12. And now I'm maybe a 2, and that's not all the time anymore. It's not constant like it was. My tremors are gone.
Wow.
Completely. My spasms have subsided almost completely. My muscle cramps are almost completely gone. Just everything has significantly changed in my life.
Wow. Were you expecting that?
I was hoping for it.
Yeah.
Because of what had happened with the first small dose that I had. When I had the first dose, immediately my fibromyalgia was gone.
Wow.
And my back pain was significantly less, but I was still 6'2" and 8, and I still had the spasms and all those things. But after the last treatment, it's completely like night and day.
Wow. Now, did you say your significant other also had treatment?
Yes, he did.
What was his problem?
He played football when he was in college and had a lot of back issues and always in pain, always, couldn't do a lot. Couldn't get him to take the garbage out, But he got treated at the same time, and he's doing fabulous. We went on a cruise just for his 75th birthday, and he was finally able to walk on the islands and walk all over the ship and do everything without being in excruciating pain and not being able to do it. So it's been wonderful for both of us.
So this is interesting to me because I purposely don't know any of this before I sit to talk to you. I just want to see what I discover. But you both had very different, I guess you'd say, diagnoses as far as what was wrong, and yet both of you seem to have had pretty dramatic results
We have.
from the therapy. And also it has an impact on your lifestyle, saying, hey, we're going to do things that are kind of fun in life now,
Yes.
instead of feeling like we're constricted by our pain and symptoms.
Yes.
Wow.
It's been great. It's been phenomenal.
Did you have anybody speak to you and say, this is a sizable investment? Did anybody come and say, I think, it's not really proven enough. You might be wasting your money. Were there naysayers?
Oh, of course. There's always naysayers. I mean, but I found a long time ago that if I don't listen to my gut and listen to my instincts, that I regret it later. And so I was a little concerned about the money, but if I don't have my health, I don't have anything. Right. So the money is irrelevant. If I don't have health and I can't enjoy what I'm doing, then what good does the money do? It doesn't do you any good at all. So it wasn't important to me. And really the expense is minimal. I mean, compared to a lot of other things. And I have cut down on all my prescriptions because I was on 5 prescriptions. I only take 1 prescription now for my blood pressure, and just one little one. And so I save money there. I'm not spending that every month. I was going to the chiropractor constantly, trying to put my back and my hips back into place because my hips kept popping out of the joint. And so I don't have that expense. I still get my massages because, gotta have those. That's the perk now instead of being essential. But so I saved a lot of money overall. So really, if you amortize it out, it's not really expensive at all. It makes sense to do it.
Wow. So this is pretty dramatic, and you seem very energetic and I guess I'd say ready for life.
I got my life back.
Yeah. So your son, who kind of got you started on this path in the first place, has he commented back to you, about how he experiences you now?
Oh, he's astonished at how well I'm doing. Yes, he's quite impressed, and actually he's 31 years old. He started developing tremors also. So I don't know, maybe hereditary in my family. I'm not sure, but I took him and got him treated, and his tremors are gone.
Wow.
So he's doing wonderful, and he talks about it to everybody. Tells his friends, you need to do this if you have any issues, and their parents and things. So he's a big advocate for it now.
Oh, that's amazing. Well, thank you so much, Mary, for taking your time and sharing this rather dramatic experience with us that's really affected the whole family. So that's terrific. Thank you. So, Jane, I'm looking forward to this conversation. Thanks for taking the time. Tell us about your background, what you do.
So I'm an herbalist, and I love everything natural, everything holistic. It's what I do for a living, so I'm really lucky.
And this type of stuff that you develop, how is it used?
Well, I have things that are antiviral, I have things that are anti-parasitic, I have things for just everyday health like turmeric and spirulina, so superfoods that just help people be well and stay well.
And this is
So
your
it's cool.
world, basically, for a lot of years, your whole life.
My whole life.
Yeah. So you've been challenged or struggling with a problem, a pain problem. Can you talk about that?
Yes, so 22 years ago, I had a water skiing accident where I literally disconnected most of my hamstring on my left leg. In fact, it's still in a ball in the back of my leg. And the doctor basically told me, this is not going to disturb your life, except for you won't be able to run anymore. And I was kind of like, okay, is there anything else that I am not going to be able to do? And he said, no, you should be able to do everything else, but run. So surgery was kind of like very invasive, and I just kind of opted out of that option. And so for 22 years, I've just been pretty much doing everything. But about 8 years ago, I started having serious pain in my left knee. And I kind of thought, well, maybe this is because of that hamstring injury. My structure is off. And it turns out I have bone on my left knee. So just a lot of pain for 8 years, and I've done a lot of stuff with it, like PRP and turmeric and ibuprofen. Yeah.
So at this point, how is it impacting you? Are you able to do the things that you would typically do, or it's at a point where you can't really move like you used to?
Yeah, well, it's at a point where I have to slow down or stop or wear a little brace on my knee. Like if I'm hiking and I'm going down, going up is fine, but when I go down, it's super painful. So I have these seasons of hiking where makes me stop hiking as much as I would like to.
And when you say bone on bone, it's just the cartilage is basically gone and it's just scraping.
I guess there's a thin layer of cartilage
Yeah.
from what the x-rays say, but it's, bone on bone.
And did they make any recommendations? Like, did they say you should have surgery, or what was the consensus on that?
Yeah, basically the doctor said, well, it's just a matter of time, live with the pain as long as you can, and you'll just have to have surgery. So it was like the older you can get, the better. And so it's just kind of like not even any other options. It's like surgery is your path, but put it off as long as you can.
So you obviously avoided surgery, when you tore your hamstring so badly. Wasn't an attractive proposition for you this time either.
No, and the thing is, all those years ago when I tore my hamstring muscle, the doctor basically just said, unless you were a professional athlete that needed that muscle to help you in your career, it's such an invasive surgery that there's really not a lot of reason for you to do it. So he didn't really encourage me to have surgery then, but I was very much encouraged to have surgery on my knee.
And a scale of 1 to 10, how bad is that pain?
It's about an 8,
Wow.
almost every day.
Way up every day.
Yeah.
Wow.
Yeah.
So it's pretty serious.
Yeah.
So now you're going to try something else instead. Tell me about that.
Okay, well, I stem cells are something that I research and I love and I know about, and I'm so excited about it because I believe the body has the ability to heal if you give it the right tools, and it's just something that I've been wanting to do for a long time, so I'm super excited to do it.
And your this aligns with your philosophy, it seems like, very well.
Completely. Sign me up. Yes.
So I don't have to sit here and try to convince you that this might be a good idea.
No, I would be the first one in line.
So, and what are your expectations? You're going to go and you're going to have the procedure done, and then after it's done, what would be a good outcome for you?
Well, in a perfect world, the outcome would be I completely regrow a good chunk of cartilage right there. And provide some space between those bones so that I'm out of pain. And I really expect to have really good results because I study epigenetics. I love the belief system, how it affects our biology. And I also have the lifestyle clicked in. I take care of myself. I eat right. I eat clean. I take out anti-inflammatory foods. And I believe that this is going to be a puzzle piece that's going to help me heal my knee. So my outcome my expectations are very high.
Well, you mentioned a little bit of the psychological aspects of this. You have the kind of the lifestyle around you, the biochemical stuff that's good, the activities, etc. But how much influence do you think your own psychology is going to have on the outcome?
Huge.
Huge?
Huge. I really feel like we have a lot of control over our genetics and over the health our body expresses. And I think that sometimes when we get help like this, like stem cells, our body makes stem cells. And to me, this is like we get help from Mother Nature with modern medicine, with this kind of technology. And I think that your belief systems have to be there. If you don't believe something's not going to work, if you believe something's not going to work, I think that your chances of it working are less than if you're fully aboard with the belief system that it's going to work.
Well, we're actually going to film you getting this treatment, so I appreciate you opening up your life and allowing us to walk in and observe what's going on.
Yeah.
And we're very interested in seeing how this all goes.
Yeah, cool. I'm excited too, so yeah.
All right, Jane. So we're going to get going with the stem cell procedure. I've already numbed this up a little bit with some cream here. At this point, I'm just going to apply some betadine to kind of clean the area. I usually make a little bullseye just with the tip. Kind of helps us know where to go. The ultrasound does that for us though too. Perfect. So 1 unit is 1 cc of stem cell mixture. Within that is about 40 million cells. Most of those are proteins, cytokines, exosomes, signaling cells, growth factors, healing factors, and there's probably about 3 to 5 million live mesenchymal stem cells.
Okay.
Again,
And does it hurt?
if you've ever had a needle poke before, an injection before, it's just like that. Okay. It doesn't hurt any more or any less than that. The fluid's pretty thin, and so unlike the gel shots that they do, you can't really feel it going in very much, so it's not very painful.
Okay, cool. I'm excited.
Okay.
Like I'm ready. I'm even ready for some pain if I need to.
Yeah. Hopefully, less the pain part.
Of course. Yeah.
But
Well, I
don't-
think it's going to be probably less pain than what I've been going through with just the daily pain I have on my knee.
Usually, yes.
Yeah.
Now, anytime you put something into an inflamed area, an area there's damage, there usually is an inflammatory reaction. The stem cells are a natural anti-inflammatory, so they will decrease that. There may be a little bit of soreness today, but should feel right as rain tomorrow.
Okay.
Okay?
Yeah.
Okay, Devin has the stem cells here for you. We're going to let you warm those up.
Oh, sweet.
Hold
on
on
to
to them, make them your own. Tell them where they're going.
Give them some love.
Absolutely. Yeah, they need to become a liquid before we can inject them. Otherwise, it doesn't quite
This is
work.
really kind of a cool part of this.
Yeah.
Like I love this.
Well, you get to put your own energy,
Yeah.
your own good thoughts into those stem cells as well as you're holding them and warming them up.
I
So
kind of have the chills.
yeah.
Like this is so cool.
So they're from perinatal tissue from scheduled C-sections right here in the valley. Healthy young women who have been screened and tested to make sure there's no communicable diseases or anything like that.
Wow.
So the area where we're going to insert is here lateral. I'm right over the patellar tendon at this point. If we go up just a little bit, we'll see the bone. That's the bone right there.
Mm-hmm.
Okay, and then as we go down, then we'll move into the tendon more, which is where we're at there. And then if I twist a little bit, we'll be able to see the edge of the bone over there on the left side,
Mm-hmm.
tendon up top. So we're
Okay.
going right into that space right in the middle. That's it. Okay, we're going to feel a little poke. Okay, now we'll see, we kind of see the tissue moving a little bit. And here, see that down there?
Mm-hmm.
That's the fluid going in.
Oh. Yikes.
Yeah, little pressure.
Mm.
Perfect. We're all done.
It was a little painful, but
Yeah.
totally good.
You all right? You're not
Super
gonna,
tight.
You're not going to
Feels-
faint, right?
Oh no.
Okay.
Yeah.
Thank you.
Wow.
I'm going to move you just a little bit, okay?
Okay.
Yeah, it's going to feel just a little full right now.
Yeah. I guess what people don't realize is it's such a simple, really non-invasive procedure.
Yeah, only takes a few minutes. Starting to calm down a little bit now?
Yeah.
Okay. And then we'll have you lay down, do a little bit of acupuncture. And by the time you lay down, it'll probably be feeling a lot better. After the acupuncture, we'll be feeling a lot better.
Okay.
Maybe a little bit sore tonight,
Okay.
but like I said, it's more the soreness just from the needle poke rather than the stem cells. Tomorrow you'll feel great.
Okay.
Okay?
Perfect.
Yeah. And
Thank
then we
you.
just avoid any high impact activities for the next few weeks if we can.
Okay.
Okay. You can take this little plastic off in 3 days.
Okay. And no hot tub or anything.
Yeah, you can take a light shower, but stay out of the pool or the hot tub just for
Okay.
now.
Okay.
Okay. All right, my dear. I'm gonna clean this stuff up, and we'll have you go ahead and lay down. We do combine our stem cell therapy with acupuncture and with heat as well.
Okay.
We prefer heat over cold, although cold is good for reducing inflammation and swelling. Heat actually opens the blood vessels, gets the blood moving a little bit more. So we will put a little bit of heat kind of on that area. Perfect. All right, are you comfortable?
I am.
Okay. The next part, you just get to relax as you get some acupuncture, and then we'll
Okay.
see you afterwards.
Okay.
Okay? All
Thank you.
Any more questions?
No.
Okay. We're all done.
So is that about what you expected?
It was pretty much exactly what I expected.
Yeah.
But I think what made it
Thank you.
more what I was expecting was the PRP injections I had.
Was it similar to that or not really?
Shorter, and it doesn't feel as full. Like when I had the PRP, my knee just felt like full of pressure.
Right.
This one did for a minute,
Mhm.
but other than that, like right now, it feels fine.
Wow.
Like not even. I think it's maybe all the love I put in it. I don't know.
That's great.
Yeah,
That's great.
it's cool. I'm so excited.
I could see.
Yeah, truly.
Right on.
Best day ever. Best day so far.